So now let's talk about blood pressure. So we know that blood pressure for the artery series is always going to be much larger than that of the vein series. And that is just because the artery series, we are getting blood straight from the heart. And when the heart gives us blood, it actually goes, it's getting pumped, right? It's getting pumped. So hold on a second, let me just draw these out, and then I'll show you what I mean. All right, so the aorta is pumping blood out, and so that blood is going to have the largest blood pressure, and then the arteries are going to be continuing that blood pressure, and then there's a huge dip once it goes through the arterioles. Arterioles are the actual blood vessels that does blood pressure control. So the arterioles are the ones that do blood pressure control. So, for instance, if you have high blood pressure, the medications that you take and whatnot, all that goes and stimulates the arterioles, not so much the artery or the aorta. Definitely not the aorta. Okay, so from here, you go all the way down to the capillaries. And if you can see, at the capillaries, we have 0 blood pressure. Okay, you want 0 blood pressure in the capillaries because it's one blood cell doing exchange with one body cell. Okay, and then from this point on, you start to pick up a little bit of pressure because you are now collecting blood and pumping it through the venules, and then from the venules you go into the veins, and then from the veins you go into the vena cava. Okay, I know my graph is not the most perfect, but what I want you guys to see is this. I want you guys to see that the vena cava, which is the biggest biggest vein in the body, if you guys can see, this is lower than that of the aorta. Vein, which is the second largest, is going to be lower than that of the artery. Venule, again, is going to be lower than that of the arterial. So what I want you guys to see is that the vein series are always going to have a lower blood pressure than that of the artery series. And also, what you need to take away is that the blood pressure is controlled at the aorta, and at the capillaries, we have 0 blood pressure. So if you look at this, assuming that this is your arterioles and these are your capillaries, so let me show you what capillaries are supposed to look like. Okay, so these are your capillaries. We actually have these things called sphincters. So that right there is a sphincter. And the sphincter, what it does is it's actually going to be squeezing, okay, your arterioles, and this is what is going to control your blood flow. So your blood cells will go in to the capillaries, because this area is the capillary area. This is capillary. This right here is the arterioles. So it's going to go into the capillaries, and one blood cell at a time is going to squeeze itself through the capillaries, okay, and then all of them are going to come together and then leave through the venules. So what I want you to see is this. There are body cells like this, and the body cells in between the capillaries are going to do some type of exchange, and the exchange happens like this via diffusion. Good. What I want you guys to also see is this. Capillaries are going to have 0 pressure. So the arterioles, the artery series, it's kind of like, you know, when you're swimming, like swim meet competitions, when you are able to push yourself against the wall, that's basically what the heart is doing. You're pumping blood out through the artery series. So you have that initial push. But the capillaries is 0 blood pressure. So when the veins are trying to pump blood back up to the heart, you are basically going from 0 pressure and building the pressure. It's kind of as if someone is telling you to swim from the middle of the pool. So when you like are dropped in the middle of the pool and they're asking you to swim, there's no push, no one's pushing you, so you don't have that head start. Does that kind of make sense? Good. So this is what I want you guys to see. I want you guys to see this is one of the reasons why the vein series are always going to have a lower blood pressure than that of the artery series. Good.